Assalamu alaikum, this is Shama and today we're going to discuss our last video on the series of videos on magnesium metabolism and its regulation. So today our topic is hypermagnesemia. What is hypermagnesemia? What we understand by this word? Hyper means elevated or increase. Magnesium is basically the magnesium and emia means in the blood. So what does this term hypermagnesemia means? That increased level of magnesium in the blood is called hypermagnesemia. So starting that with a discussion over it, that what are the causes of hypermagnesemia. Fine. So just recalling our basic concepts that we've already studied, that what is the source of magnesium. So how we've all studied it, that first of all, magnesium, it comes from our diet, from the food what we eat. So first source is a diet. That suppose this is our plate of food, to some extent it's plate, and these are all the food items present on it. So basically what the patient is eating in diet, that is important. Fine. Second important point of hypermagnesemia is that its absorption from the GIT tract. We've already talked that this is our GIT tract, and its absorption from the GIT tract is important. And third important is its excretion from the kidney, that what level of excretion is occurring, is it increase excretion or decrease excretion, that is important here. Fine. So now we are going to discuss the causes of hypermagnesemia, considering our basic knowledge in our mind, which will help us not to cram them but to discuss and learn them all. Fine. So just taking in diet, that suppose if the patient is taking increased amount of magnesium containing supplements like iatrogenic. So suppose if the patient is taking, number one, he is taking increased amount of magnesium sulfate. Now we know magnesium sulfate is used for treatment by the pregnant ladies who are suffering from eclampsia or preeclampsia. Now why? Very important. If you have seen my previous videos, I've explained the role of magnesium. If you've not seen, go back and watch all videos on magnesium. But a brief I'll explain here is that magnesium, it is important in relaxation activities of our muscles. So in eclampsia and preeclampsia, there is a high BP. That BP will be reduced by this magnesium sulfate. Now if the patient is taking increased doses of magnesium sulfate, that can cause toxicity. So that is important here. Moving on, if the patient is taking magnesium containing antacids, that can be a cause. Or if he is taking magnesium based laxatives in excessive dose, then they can cause hypermagnesemia. Fine. So this is all related to the diet, increase uptake. So of course when you're taking an increased amount, there will be increased absorption. So all these factors, they collectively lead to hypermagnesemia. Moving on to the kidneys. Now kidney is the organ from where it has to reabsorb. If it's reabsorbed in increased amount, then there is less excretion, or if reabsorbed in decreased amount, then there is increased excretion. So how this whole occurs is that, suppose here what will be the cause of hypermagnesemia, just a basic theme to remember, that the causes of hypermagnesemia is that there is decreased excretion of magnesium, and vice versa, there is increased reabsorption of magnesium from the kidneys. It's just basic. When will this occur? If the kidney has failed, if the kidney is not working properly. So if the patient is having renal insufficiency, then it is the, you can say it's the most common cause of hypermagnesemia is renal insufficiency. Why? Because of course it is unable to excrete magnesium properly. That is the cause. Second, if there is adrenal insufficiency, just a sister of renal adrenal insufficiency. Now why in adrenal insufficiency? As we know, adrenals, they produce a very important hormone called the aldosterone. Fine. And we know aldosterone has a role in absorbing sodium and excreting potassium, and we know that if the potassium is excreting more, then it will also cause increased excretion of magnesium. But here, if there is adrenal insufficiency, there will be decreased amount of this aldosterone, which will ultimately cause decreased potassium excretion and hence decreased magnesium excretion, leading to hypermagnesemia. Fine, that's important. Now another very important point that will help us in remembering is that if the patient is having cellular damage or cell lysis. Now why? As we know, suppose this is our cell, we know magnesium is an important ion that is present intracellularly. So whenever this cell, which is suppose a bag of magnesium, when this cell will get damaged, then it will release its contents, and when it will release its content, then magnesium will be released along with all its contents, and it will cause hypermagnesemia. Fine, this is an important point. And we know, we've discussed in the introduction video, that muscles are a source of storage of magnesium. So whenever there is muscle damage, and it is a condition called rhabdomyolysis, in which there is degradation, or you can say muscle loss occur in this condition, death of the muscle cell, that will also cause increased release of magnesium in the blood, leading to hypermagnesemia. So that is an important cause, and these are all the causes that will cause hypermagnesemia in the patient. Plus, another related to this cellular damage is that if the patient is having burns, it can also cause cellular damage and release of magnesium. Plus, we know that severe acidosis. Now, whenever there is acidosis, it causes hyperkalemia, and since magnesium and potassium has same type of metabolism, so its severe acidosis will cause hypermagnesemia also. Now, a very important point, extracellular fluid deficit. What happens when there is extracellular fluid deficit? Very important. Now, suppose, it's a very important concept here, that if the extracellular fluid is deficient, what will the kidney detects? That okay, there is less fluid in the body, and as a result the GFR will be reduced. When the GFR will reduce, it will cause the renal fluid within it to move slowly. Now when it moves slowly, there will be increased time for the kidneys to absorb more. Fine, to absorb more and to conserve the fluid and minerals in the body. So it will lead to increased magnesium absorption, and that ultimately in increased amount will cause hypermagnesemia. That's very important. And on the contrary, if the patient is having increased extracellular fluid or fluid overload, in that case there will be hypomagnesemia, opposite to this whole procedure. So these are all the causes of hypermagnesemia. Fine. Now next important topic that we'll discuss is that once the hypermagnesemia is developed, then what will be the clinical features? The clinical features of hypermagnesemia will be, now just to remember the clinical features, a very important point is, I've explained you many times and repeated a lot, that what does this magnesium does? It plays an important role in relaxing the activity. Which activity? Of muscles, of the neurons, neuromuscular activity, all these. So if the patient is having hypermagnesemia, what sort of clinical features will develop is that there will be excessive relaxing activity. Fine. So first and the most common feature that appear is progressive loss of the deep tendon reflexes. Why? Because there is hypermagnesemia in the body, so progressive loss of deep tendon reflexes. Moving on to another feature that develop is that of course patient will have nausea, patient will have weakness, because he's unable to properly work by his muscles. Thirdly, what happen is that since cardiac is also muscle, so cardiac changes will occur and those changes will be seen on ECG. Now hypermagnesemia changes, they are same as that of hyperkalemia. Fine. So same features as that of hyperkalemia. Now what are those features? That of course the heart rate, since there is hypermagnesemia, increased magnesium in the body, so what will happen is that our heart rate will be prolonged. So the you can say that to easily remember all the ECG finding is that the duration of the heart or the cardiac cycle is increased. Now when this duration will increase, what sort of features will appear? That is very important. What are the features? That first of all, of course, the PR interval will increase. There will be increase in the PR interval, plus our QRS complex that will widen, because now there is prolonged phase of ventricular depolarization. And moving on to what will happen to the T wave, that since there is increased potassium and magnesium which occurs same side by side to each other, so this will cause peaked T wave, or you can say elevated T waves. So this is an important finding on the ECG that are seen. And basically what is happening, that arrhythmias are developed in the patient. These not arrhythmias exactly, these are the changes that are seen on the ECG of the patient. Moving on to that, the muscles will progressively become weak, and what will happen, that muscle paralysis will start to develop. Muscle paralysis develop and somnolence is increased, leading to coma of the patient. And very important point, the most important muscle of our body is the respiratory muscles. So respiratory failure can develop, or cardiac arrest can develop because of this progressively decreased cardiac activity, and it can lead to the death of the patient. So these can be the reasons of the death of the patient. Fine. So these are all the clinical features that will be observed in that patient, plus in addition to all, facial paresthesias will also be present. Fine. Now moving on to that, how we will treat such a patient, what will be the treatment of this patient. Now we know that what is happening, that patient is having high levels of magnesium in the body. So how we will manage it, that we will, just a second, now we are going to discuss the management of hypermagnesemia. Now talking about the management of hypermagnesemia, how we will manage the disorder, we will start again how we started for its causes. That first cause was increased dietary intake as an iatrogenic measure. So what we will do is that we will stop, I repeat, we will stop the magnesium containing drugs administration. First important point. Then what we'll do is that the available magnesium in the body will start to excrete it. So second step, what we'll do is that we'll start to excrete the magnesium. We already know how we excrete it. We excrete it through the kidney, and how we increase excretion through the kidney is we give saline to the patient plus diuretics that cause increased excretion of magnesium. Moving on, that once we have done this, how we'll proceed further is that since patient is having lot of effects on its heart, so while making a big heart here, so just remember it, that as we studied before, it is causing effects on the heart, the decreased activity of the heart. So what we'll do is that we will give a drug that is cardioprotective. Now we have to save the patient from causing life threatening damaging to his body. So what we'll do is we give IV calcium gluconate, that is a cardioprotective drug. Okay. Moving on, since the patient is, most important cause is renal insufficiency, means the kidneys of that patient are not working well, or there is decreased activity of the kidneys. So what we'll do to the for this management is we'll dialyze the patient. So dialysis of the patient is performed if he is having renal insufficiency. Moving on, that if the patient is, as we know, respiratory muscle paralysis occurs in this disease. So if the patient is having respiratory paralysis, or we are suspecting that respiratory paralysis is about to develop, then what we'll do is we will intubate the patient.